an opportunity for some open discussion around any issues or things that might arise. So I would encourage you to participate at a level that you feel comfortable with. It's always nice to have some engagement from those on the call and get the best out of the session and things. So I would welcome any comments in the chat, or if you feel comfortable enough to raise your hand and speak, then I would welcome that. We're going to be using Menti. I'm joined by my project support officer, Dawn Guest, who's on the call. She's going to be helping me navigate through some of the technical aspects of today's session. So yeah, as I said, we're going to be using Menti. So if you've got your phone to hand, it's www.menti.com, and the code will be put in the chat box. So we'll move on to the next slide, please, Sophie. And then the next one onto Menti, and we'll go straight into the questions. If Dawn's put this stuff in the chat, I can't actually see the chat function, so if we've got that, just a few questions just to help you get settled into today's session. So the first question that we're going to share on Menti is, what is the average age of menopause? Can we get that up on screen, ladies? Or perfect, thank you. $48, $50, $45, $49, $49. None. Okay, 52, 48, 44, 51. Yeah, 51. That's the right answer. Brilliant. 45. Perfect. So can we move on to the next question, please, Dawn? Can you list 3 symptoms of menopause? Hot flushes, absolutely. Depression, anxiety, yeah. Headaches, joint pain, yeah. Brain fog, lack of concentration, absolutely. Headaches. Fatigue, tiredness, yeah, definitely. Sleeplessness, absolutely. Weight gain, a bit on the fence with that one. Pain, fatigue, lack of motivation, yeah, absolutely. Yes, me too. Right. Okay, and then moving on to the final question. So, as an employee, how likely are you to say if you're not fit to work due to menopausal symptoms? Unlikely. Yeah.
Sorry, Michelle, there's a black square in front of the on the screen that Dawn's sharing, so you can't see the
You can't see the,
the results. I don't know if you've got it as well, but it's right in the middle of the very unlikely, so we can't see what the number is.
Right, okay.
I don't know if
Dawn,
could.
Would you be able to stop? Yeah, I can see it. Yeah, I think a few people can. My screen's all right, actually.
Yeah, I can't see that, sorry. Should I stop sharing? Or...
If you stop sharing and then reshare again, that would be good.
Okay,
please.
I'll try that.
Thank you. Because we just got one final question, so I just would like to see that.
Hopefully this will help.
Yeah, no worries.
Is that better?
Still there?
No, it's still there.
Oh, right, I can't see that on my screen. Sorry, I don't know what it is.
Right, no worries. Let me see if I can get it up. Can other people see it? Is that what we're saying? Yeah, other people can see it as well. Right, okay. So let me see if I can just share my. If you stop sharing, Dawn, I'll see if I can just do it on mine, because I'm keen to get this last question up.
Oh, that's strange. I've just seen it in the chat. It doesn't look like that on my screen.
No, I can't get it on. Right, okay. Do you think, Sophie, could you do a very quick poll for me, please?
Yeah.
And the question is, as a manager, how confident do you feel about having a conversation about menopause? So as a manager or team leader, how confident would you be in having a conversation? Quite confident. Good. Is there any males on the call, just out of interest? No.
Is that work? Has that
Yeah,
worked?
yeah, that's come up. Thanks, Sophie.
No worries.
Very confident, unsure. Confident. Comfortable. Not a manager. So just as an individual, as a colleague, as a peer, how confident would you feel in having that conversation with someone that you're working alongside? Comfortable. Right, okay. So got a mix there. All right, that's perfect. Okay. Thanks. If we can so I wouldn't have all the answers. Yeah, absolutely. And I think that's it, but it's knowing where to signpost to as well, isn't it? That's the kind of thing that we're going to kind of come across today as well. So all right, we can take that down, and then if we can go back onto the slides, that would be great. Thanks, Sophie. I'll just take my poll down. That's in the centre of my screen now. So yeah, average age is 51. 8 out of 10 women who are menopausal in work. It's about opening up and normalising the conversation and why we're talking about menopause in Greater Manchester, and kind of what can be done to help people in the workplace. We're looking to make colleagues and our places of work more aware of how menopausal symptoms impact women at work and those around them. And by creating a greater understanding about what menopause is, and a culture where we can talk about the impact of symptoms and what they have on working lives. So improving the information, improving the support that is available, and by having a proactive wellbeing culture when it comes to the menopause can really help, especially where we can talk openly about concerns with colleagues and managers. And if you're a manager or team leader, especially, then how you can help and support someone within your team or department that is suffering with menopausal symptoms by having the knowledge, the awareness, and help to make any reasonable adjustments to the workspace or the working day. Having a look at a wellbeing action plan can sometimes be helpful as well. In the Greater Manchester Health and Wellbeing Toolkit, there is a whole section on menopause with resources and hyperlinks to a wellbeing action plan, which can kind of guide you through some of the questions, or it might help navigate the conversation or help to initiate that conversation as well. Okay, if we can move on to the next slide, please, Sophie. Okay, so again, 4 reasons why we're talking about menopause at work and the demographic. Menopausal women is the fastest growing workforce demographic in the UK, with over 4.4 million women aged over 50 in work in the UK. According to the Faculty of Occupational Medicine, nearly 8 out of 10 women are menopausal and in work. Many of those are in leadership roles or in key leadership places. So we want to be able to keep those women in work. One quite shocking statistic, can't say that, put my teeth in. 1 in 4 women consider leaving work because of menopause. And if you consider our health and social care workforce, especially, that if we lost a quarter of our female workforce aged 40 to 60, what a significant impact that would have. So it's about providing a culture where women feel supported and able to talk about the menopause and some of the symptoms that they may be experiencing. The business case for that, for any organisation, estimated cost of replacing an employee is around 30k. Looking at reducing absenteeism, so sickness rates, reducing presenteeism, you know, women who are dragging themselves in, who are not fully focused, who are trying to hide what's going on, and don't take you know, the time to be able to look after themselves properly. Social responsibility. It's the right thing to do. You know, we want to support our colleagues. We need to embed that wellbeing culture within our workplace, for not just for menopause, but for other kind of health and wellbeing issues as well. But for the purpose of today, menopause especially, we want to enable our colleagues to perform at their very best, and we have a legal obligation to do that. We have a responsibility to provide that kind of open, transparent, supportive conversations with our staff that are in work who are experiencing some quite severe menopausal symptoms. We need to be aware of the legal framework under the equality legislation, in particular around gender, age and disabilities. Okay, so we're going to be watching a video on the next slide. So Dawn is going to share that video. Just bear with us for a second. Unfortunately, you've not got rid of my voice. I'm doing the voiceover on this as well. So it's only just been done, so there's still a few tweaks, but I really was keen to share this with you for today's session. So yeah, away we go. Thanks, Dawn.
Greater Manchester Wellbeing Toolkit was co-designed with colleagues from across the Greater Manchester system. It is packed with practical tools and guidance to help you to look after yourself and support those around you as a peer, team leader or line manager. The toolkit also offers an opportunity to practice having good conversations, as well as delivers a series of insight into sessions across different themes that have been flagged up, such as hybrid working, menopause, LGBTQ health inequalities, musculoskeletal and mindfulness. In this short video, we will be exploring menopause awareness, giving insight into symptoms and how it affects women in the workplace, and how we can support colleagues and line managers to start the conversations and signpost to the help that is available. Menopause. It's always been around. Today, on average, women reach menopause at around 51 years old, and many women work until their late 60s. Around 3.5 million women aged over 51 years are currently employed in the UK. 8 out of 10 menopausal women are in work. This is a stage in every woman's life. It's not always an easy transition. 3 out of 4 women have menopausal symptoms. 1 in 4 have serious symptoms. How does this affect women in work? The most common symptoms are poor concentration, brain fog, tiredness, feeling low, depressed, low confidence, and hot flushes. 45% said menopausal symptoms have a negative impact on work. 47% who have needed to take time off due to menopausal symptoms said they would not tell their employer. 1 in 4 women consider leaving work because of menopause. Imagine if we lost a quarter of our female workforce aged 40 to 60, what would that do? By talking about it more openly, no more taboo, and with the right help and support, we can improve that. And it's not just something women need to know about, everyone does. Whether it's you personally, if you're supporting your partner, friend, family member, work colleague, or if you're a line manager. Menopause is a stage in every woman's life, and usually defined as when a woman has not had a period for 12 months. The following day is classed as menopause. Perimenopause is the time leading up to menopause, when a woman may start to notice some changes. Postmenopause is the time after menopause. When we talk about menopausal women, we mean those in perimenopause or postmenopause. Menopause age usually happens between 40 to 55, but can occur up to mid-60s. It can also occur earlier. Naturally, 5 in 100 women menopause between 40 to 45. And in Britain, 110,000 women aged between 12 to 40 are affected by premature ovarian insufficiency. Menopause can also happen early due to surgery such as hysterectomy and certain types of cancer treatments such as chemotherapy. Our hormone levels change throughout our lives. The main ones which have an impact on menopause are estrogen, progesterone, and testosterone. Estrogen nourishes the tissues of the body, regulates bone turnover and cholesterol, as well as keeping the liver and heart healthy. Progesterone boosts feelings of calmness, aids sleep, and can help improve mood with blood sugar levels. Testosterone increases motivation and optimism, helps women to feel brighter and more assertive, increases bone density, and boosts sex drive. During menopause, these hormones can be out of balance. Estrogen levels fluctuate and progesterone levels decline, which is when a woman may start to notice symptoms. Symptoms of menopause can vary from person to person. There are a wide range from physical to psychological, such as low mood, brain fog, hot flushes, fatigue, itchy skin, poor sleep, and anxiety. Every woman is different, and some don't experience any major changes at all. Others will notice some symptoms, and 1 in 4 will experience serious symptoms. Symptoms, on average, last 4 to 8 years. Symptoms can be managed in several ways. A woman may choose to go to their GP or medical practitioner, who will use the NICE guidelines to determine the treatments they will be able to offer. This includes hormone replacement therapy, HRT, which can be administered by tablet, patch, or gel. A GP can advise on the safety and effectiveness of HRT, if it's a good idea. Go along prepared with a history of your menstrual cycle and symptoms and for how long. Others choose a more natural approach to using complementary therapies or herbal therapies, including St. John's wort, red clover and milk thistle. Always choose a qualified herbalist or nutritional therapist for advice. Lifestyle changes can be beneficial, both during and post-menopause. Introducing a healthier diet, quitting smoking, reducing alcohol, taking up some kind of physical activity, and introducing vitamins such as calcium and vitamin D may be helpful to mitigate some symptoms. Post-menopause health is important too. It's not just about things during the transition. Consider things like osteoporosis, cholesterol, and heart disease. A GP can advise on this too. The most important thing is to understand what menopause is and choosing the right approach for you, managing symptoms and your longer-term health. Women struggling with menopausal symptoms should not feel afraid to reach out for help and support from medical practitioners, family, friends, work colleagues, wellbeing champions, line managers, and HR. Ask about menopause guidance or policy within your organisation. The Greater Manchester Health and Wellbeing Toolkit is packed with helpful resources and information about menopause. It's important for everyone to talk openly about menopause. It isn't only about women, it's about everyone. Let's talk about menopause.
Thanks, Dawn. Okay. So just some discussion points really now, for people to kind of just open up the floor if you like. Is there anybody surprised by any of the stuff on the video or what we've said, some of the figures? Did you all watch the Davina program the other night? No. Yeah, we're getting some yes nos. I can't see everyone. Yeah. A number of years, yeah, absolutely. Yeah. Yeah, it was really interesting actually. Yeah, definitely catch up with it, Kate. It was well worth the watch. Yeah, if any of you can get it on Channel 4 catch up, it's definitely definitely worth watching. But a lot of people are surprised by the effects. Yeah, how it affects everyone, and again, it affects. There's a range of those physical and psychological symptoms. What is the one thing that stands out to people? Is anyone brave enough to? I didn't realise that testosterone. Yeah, yeah, and I think that was something that stood out for me the other night on the program, that one expert on there was saying, we get this HRT and we replace 2 of the hormones but don't replace 3. So it's like, we'll take all 3 away, we'll replace you with 2, and expect you to kind of live a fulfilled life. So yeah, it's quite shocking really. And I think the saddest thing for me really is around losing staff as a result of menopausal symptoms. I think that's probably one of the most significant things for myself, that women who've worked really hard to kind of get up to that career ladder or to that place where they are in the careers, and then suddenly menopause hits, and it's, you know, people leave their work as a result. So yeah, joint pain as a symptom, yeah, absolutely. Yeah, it was a follow-up from the last one. Yeah, it was. Alzheimer's, absolutely. Yeah, that brain stuff was quite astonishing as well, you know, how it impacts that brain function. And really when you look at it, it's not surprising. Funding. Yeah, absolutely, yeah, definitely. Alzheimer's was shocking. Yeah, it was. It was for sure. So you know, obviously they addressed the problem if women have had breast cancer in the past and are not able to take HRT, then, you know, the herbal remedies as well, you know, that lifestyle stuff is really, really you know, important, and can definitely mitigate some of the symptoms, you know, specific to the brain effects. Yeah, definitely. So just thinking about work, and just put it in the chat function, or if anyone would like to speak, then please do. But what difficulties might someone experience at work as a result of menopause? What are the main difficulties you would expect? You're all very quiet. Hot flushes, heavy bleeding, yeah. Missing deadlines, not being present, tiredness, forgetting. Yeah. Touching my laptop and not knowing what I'm doing, yeah. Definitely. All the side effects. Yeah, and the link with menopausal symptoms and COVID, there's a paper. Oh, someone's put their hand up. Thank you. Sorry, I can't see your name. It's Karen.
Shall I be brave?
Go on, please do. Thank you.
So I'm someone who has recently experienced quite a lot of the symptoms, and it was like in November, I came back from a holiday, back to work, and I literally could not stop crying. Day in, day out, could not stop crying. And another symptom I experienced was anger at everybody. So I'd be going on Teams meetings and I was just really furious with people. And then I'd look at myself in the mirror and be angry at myself. And it was quite strong symptoms. And I suffered them for quite a while. And then I just realised that I might be experiencing perimenopausal symptoms. And one morning I logged on and I Googled, can you experience morning sickness if you are perimenopausal? And it said yes, because I was feeling nauseous as well every single morning, really sick. And it said yes. So I thought, right, I'm going to do something about this. So I contacted my doctor and I've since been put on HRT. It has made a massive improvement, but there is the national shortage with the estrogel. So I've had to switch to now a spray. And it's not quite as effective, but I'm giving it some time. But I do feel generally a lot better than I did. But it was so severe, and I honestly felt like jacking the job in. You know, I didn't have any other options, and you know, I couldn't afford to, but I just hated everything.
Yeah. And that, you know, it is really sad. And I think, you know, again, just referring back to the program the other night, that was really a strong message that came through around that, you know, where women are just leaving the work, and all that wonderful knowledge, skill, experience we're losing as a result of menopausal symptoms, which is crazy, you know. And I think this is, you know, the very start of the movement. You know, we're hearing lots of stuff in the news now around menopause and how we can have those open conversations, and rather than it become a performance issue, which again is something that we need to address. We need to look at that bigger picture stuff, don't we, and think, actually, is there a health condition going on for this person, and look at that, you know, the bigger picture, as I say. But thank you, Karen, for being so honest and sharing and brave. Lots of stuff in the chat coming through there, you know, people not understanding and not giving you any sympathy, and that's what you need, don't you? You need a little bit of that nurturing and a bit of kindness to help you through your day when you're feeling rotten, and you know, to not have that and not have a go-to place is very, very sad. So just thinking about how would you like that support to work, thinking about your work environment, how would you, in an ideal world, how would you like that to, what would you like it to look like, I suppose, is what I'm asking. Anyone brave? So if your manager said, right, what can I do if I've got a magic wand? How can I best support you to get through some of these symptoms that you're experiencing? What can I do to help? What would that be? Ruth, go on. Brilliant.
Hey, I put the camera on now because I've.
Thank you.
Well, I'm a manager and I'm going through menopause 100%, and probably perimenopause or maybe up to menopause. And I think more than anything, it's supporting the tiredness, the lack of focus. I've got a couple in my team that are probably on the similar stage that I am. So I 100% get it. So I think because I'm looking at all the resources that are out there, going on as much as I can, I'm helping support them. And I get when they're tired or they don't want to, you know, the lack of focus on work and stuff, and sort of building into trying to get them to rest a little bit more, go out and have a walk, come back, you know, and recognise that there's going to be some days that they're just not going to do anything, you know, not be productive at all. Sort of shift around what they're doing, that's more the mundane tasks that aren't crucial, that they, you know, on the days that they're feeling a bit down. That a lot of them have been concerned about because of COVID sickness and general sickness, that they don't want the sickness triggers to be met. So I think as long as you can be as supportive as possible as a manager in terms of trying to shift around the work, I mean, obviously they're here to do a job and get, you know, yeah. But these are long-standing staff that have been here for years and years and years. So, you know, as far as I'm concerned, they've given as much as they can. It's up our turn to give to them. But I think as well, we've got a really good network in IT of wellbeing champions, and we had at one point like packs in the toilets. This is going to sound really like basic, but packs in the toilet of knickers and pads and stuff like that, and tablets like paracetamols, aspirins or whatever, and energy drinks and stuff like that, that just would like put there, and they would sort of like put there sort of like free to help yourself, but replace and replenish. That worked really, really well. We stopped it over COVID, but I think reintroducing something like that, just as, because I've had staff that have had to go to a charity shop to reclothe themselves because of accidents and stuff like that. We all live and breathe that, so to speak. So I think things like that are really, really important, and just those little bits of help that make staff feel a little bit more like, you know, it's normal and everyone goes through it, and let's, you know.
And that's exactly it, Ruth, those real practical things that you can do, just to say, do you know what, I can't make it better, but what I can do is show you a little bit of kindness, a little bit of empathy, and understand with your situation. And, you know, I would definitely be pinching that idea around those practical elements, especially in the toilets and things like that. I think it's fab. Thank you for sharing. Melissa, I know you had your hand up, and I'm going to bring you in there. Is that all right? Where's she gone?
Yeah, can you just give me a sec? I'll come back in a minute.
Yeah, no worries. Right, okay. We'll come back to Melissa in a minute, but if we can just bring the slides back up, and we'll move on. I'm just conscious of time as well. Thanks, Sophie. Okay, so supporting colleagues, you know, I always recommend that they do seek support from the GP if they're experiencing menopausal symptoms, and you know, the GP can obviously advise on that, the lifestyle stuff and natural remedies, and obviously medical treatments such as HRT. Your line manager, a colleague that you should be able to talk to if menopause is affecting them at work, and you know, you can discuss how you can make those reasonable adjustments for staff, and you know, maybe look at the flexible working stuff. I know it's not ideal for every area of work, but you know, it's an option for some people as well. Maybe just starting your day a little bit later, or things like that. The EAP, the Employee Assistance Programme, is provided by an external organisation, totally confidential for those staff who are experiencing high levels of stress and anxiety. It's a 24/7 helpline. It can often give that useful, helpful counselling advice, or you know, that therapy support for issues that may be affecting you at work or at home. And again, any reasonable adjustments to your work environment, and you know, just Ruth's just given just a few then, which is fab. You know, I know the situation with fans and things caused chaos and carnage in COVID times. So that's been a bit of an issue. Work uniforms, you know, for our clinical staff who had to wear these really thick, uncomfortable nurses uniforms, or you know, whatever uniform, but just the practicalities of that when you're feeling a hot flush coming and you're wearing this thick, uncomfortable uniform. So again, if any adaptations can be made there. So it's again potential options. Occupational health, if you're unsure around workplace adjustments, then you know, seeking out that support from occupational health as well. Okay, just moving on to the next slide, please. So yeah, just some examples of the sorry, Sophie, the slides have gone really small on my screen. I don't know.
Oh, have they?
Yeah.
I'm sharing them like I normally do.
Ah, that's better. That's it. Yeah.
Oh, I haven't.
Oh, it must have been me. I must have clicked off them. See, there you go. So yeah, reasonable adjustments. As I just said, considerations around dress code, difficulty sleeping, reviewing start and finish times, tiredness and fatigue, you know, taking a break in your working day. And we, on one of these sessions previously, we had someone said just having a little bed where they could take a nap throughout the day. I'm not sure some of our managers would approve of that, but you know, I suppose when you're working at home, you take your lunch break, you can have a little mindful moment. Having the washing and changing facilities, and access to sanitary products, and again, you know, those well-being conversations, you know, as I said to you about the action plan that's in place, that can really help guide and steer a conversation to someone that might not feel as open to talking about some of the symptoms and how it's affecting them. You know, it's about breaking that taboo, and giving people the space and time to be able to be open and honest. So yeah, next slide please, Sophie. So information for colleagues, some really good resources out there now, and there's more and more coming kind of onto the internet. Dr. Louise Newson, who I'm sure that you're all aware of, who is yeah, absolutely, the Balance app, who is the UK's leading menopause specialist. She has got a whole host of apps and resources, and printables, downloadable things that you can look at, that you can put up around your workplace, that you can signpost onto. There's also a symptom tracker on there as well. So if you go into your GP, go armed with your information, go with all the kind of things that you need to have in place, that you can say, actually, this is what's been happening for me. This is, what's been showing up. This is how long it's been going on for. There is the Rock My Menopause symptom tracker as well. I don't know if Dawn's put that in the chat. But again, that is another great kind of resource that you can just kind of look at from a personal perspective. It might be something that you can give to one of your work colleagues, and just say, if you're noticing this showing up for you, start to track some of your symptoms, and then you can go armed with all the information. Yeah, thanks for that. Mindfulness and relaxation for menopause. Those of you with NHS emails will be able to get the Headspace for free. They are currently developing a menopause section on that as well. So again, it's just another thing that you can kind of tap into. But yeah, as I said, there's lots of stuff out there. There's stuff in the Wellbeing Toolkit. We have a podcast that's going to be released tomorrow with Dr. Kath Monroe, who's been doing some of our menopause sessions, and we've got a live Q&A coming up with her in the coming months. So yeah, lots of resource out there. Next slide, please. So just a bit of a do's and don'ts recap, really, and do know your facts, talk about menopause, do follow the process, do keep open, be open mind, be flexible. Is that Michelle? Go on.
Oh yeah, sorry.
Hi. No, it's all
Quick
right.
question.
Go on.
I was just kind of making some notes at the side in the conversation just while it was on my mind. One of the things I wasn't sure about is with menopause, if you have a time where you are in a situation where you can't work and it is potentially menopause related, or going through the process of getting a diagnosis of menopause. In my personal situation, I was actually off sick for a period of time with work pressures, but because of the perimenopause, that triggered my situation.
Yeah.
And then I got a diagnosis, which made a massive difference, the same as the lady before, with having HRT, the GP getting on board, and it literally within a week just totally changed, made a massive difference. But in those instances, it isn't like when you're pregnant, for example, if you have morning sickness, it's an accepted part of the condition of pregnancy, if you like, and it's a female related illness that's part of pregnancy. And when you have morning sickness, you're off, but it isn't triggered because that's accepted, that's part of that condition, if you like, or it's documented as such. Is there anything within the menopause policy? I haven't read it, to be honest. It's a lot of information, but is there anything similar within that kind of safeguards you from capability? I've not read it, so I'm not clear on that. So that was my specific query, because obviously that was a bit of an issue for me. And it's managed better for me now, and I'm aware of the options. But of course, people coming up through the 40s now, and new staff coming in, etc., that's going to be something that you will have to potentially deal with going forward. But I'm aware menopause is quite a new thing for the trust as well. They've only the last couple of years introduced the policies, so it's how that is. It can be a bit token gestury sometimes, and I don't mean to be negative, but sometimes it can feel like, oh, we've got all this support and advice, but actually practically on the ground, how does that translate?
Well, there is reporting now for it is on ESR as a reason for sickness and absence. So I think that is a step in the right direction for sure. I think this is very much a movement. I think it's something that is very much high on the agenda and will continue to be. And I think it's just about the more that we talk about it, and as I said, the more that those open, transparent, honest conversations go on within workplaces, then it's kind of chicken and egg, if you like. If people don't report it as menopausal symptoms, then it will always be picked up as stress, anxiety, or something else. So it's kind of, if we don't say it, then it won't be picked up. And it's having the confidence to say that.
Difficulty as well is sometimes, as you said it rightly so, it is a chicken and egg situation where people who are coming up to that, I didn't initially associate a lot of my symptoms going on for a year or so.
Yeah.
And I didn't initially associate it with the perimenopause. But as you say, everybody's different, and it's that early stage.
Yeah.
And I don't know whether retrospectively, you know, you might already be going through a capability situation before you even start to, the 6 months, you know, before you even start to realise that there's a correlation there. So it
Absolutely.
it's almost like after the horse has bolted, you know, it's how do you get the managers to be more supportive early doors to be able to ensure that that support's in place prior to the problem occurring, isn't it?
Absolutely. And I suppose that's where the symptom tracker comes in, and that must play a key part in, you know, and it's knowing your own body and being comfortable with saying, actually, I've not experienced this before ever in my life, you know. So it's that light bulb moment, and I think there are more of those light bulb moments happening for women now, but we often wait until actually we're at breaking point, till we're kind of feel that you are completely losing control, before we then kind of acknowledge that there's an issue or there's a problem, and try and cover it up, or mask some of the symptoms, especially within our workplaces, because we don't want to be seen that we're kind of not able to do our job, or we're not functioning right, or not firing on all cylinders. You know, it's a really difficult kind of situation for lots of women to be in, but it goes back to having those wellbeing conversations as a part of your as part of the course within your working areas, you know, and highlighting some of that. So yeah, it's I don't have all the answers, sadly, Michelle.
No, but it's making sure the policies are in place and the managers are
Absolutely.
you know, because
Yeah.
I mean, my concern is that situation, as you've mentioned, you know, you're 1 in 4 ladies are choosing to or considering leaving. If you're in a situation where the initial discussions, you're not being supported, then you leave, and then you find out, oh, it's the menopause, but I've already left. You know, it's a bit late, isn't it?
Yeah, it's tragic.
Yeah.
Absolutely tragic.
But no, I appreciate. Thank you.
Yeah, you're welcome. Yeah, and you know, I think it's about what we don't do. You know, don't make assumptions about people. Don't shy away from the conversations. That's the only way that we will kind of break the taboo and have those open, honest conversations around the menopause and what's showing up for people. Obviously, not sharing personal information without consent, and you know, this is a key one for me. Don't address performance without checking those potential health issues, really. You know, look at that bigger picture. Actually, what else is showing up for this person? How can we best support you as opposed to penalize you, or get that person to go off on long-term sick, or even worse, leave whatever organization and lose all that rich knowledge, skill, and experience. So yeah. And don't give, obviously, medical advice. Always seek help from professionals. Okay, moving on to the final slide. And I do always try and finish on a positive note. And I think, you know, it's about changing our attitude to menopause. And, you know, we're fabulous, capable, knowledgeable, experienced, empowered, and wise women. You know, by the time we get to that age, stay fabulous, and kind of you know, be kind to yourself. What is it? That's the EAP number, Rebecca. So it's like your employee assistance program. which is usually attached to your workplace or organisation. Okay, we're just going to finish on a couple of Menti questions again. So if Dawn can share the Menti, that would be